A recent viral news story about a woman who allegedly reacted in an extreme way after discovering her fiancé was bald and had been wearing a wig. The internet is flooded with anger and memes. I am not here to discuss the incident or the people involved. What caught my attention was the reaction. Millions of people were talking about one thing: hair. Despite all our advances, hair still has a powerful connection to confidence and identity. And while social media is busy debating wigs, hair patches, and miracle oils, scientists have been quietly transforming the way we understand the hair loss. Today, we will separate myths from evidence. We will understand why hair loss happens, which treatment actually works, which ones are overhyped, and what's the future of hair restoration look like. Why do we go bald? Hair loss isn't simply about getting older. Every hair on your scalp grows from a tiny organ called a hair follicle. Each follicle repeatedly grows through 3 stages: a growing phase, a resting phase, and finally a shedding phase. Losing around 50 to 100 hairs a day is completely normal because new hairs are constantly replacing the older ones. The most common cause of baldness is androgenetic alopecia, or male and female pattern hair loss. In people who are genetically susceptible, a hormone called DST gradually shrinks the hair follicle. This process is called follicular miniaturization. The follicle doesn't suddenly die. Instead, they produce progressively thinner, shorter, weaker hairs until eventually the hair becomes almost invisible. But modern research has shown that DST is only one part of the story. Low-grade inflammation, reduced blood supply, changes in stem cell activity, and the environment around each follicle also influence whether the follicle continues to producing healthy hair or not. That's why modern treatments target several different mechanisms instead of relying on a single solution. What actually works today? Number 1. Minoxidil. Minoxidil is usually the first treatment recommended for both men and women. It works mainly by prolonging the hair's growing phase and improving the blood flow around the follicles. Think of it as creating a healthier environment for weakened follicles rather than creating entirely new ones. Results are slow. Most people need at least 4 to 6 months before noticing improvements, and maximum benefits often take close to a year. One important point many people don't know is that shedding may temporarily increase during the first few weeks. This is often a sign that weaker hairs are being replaced by new growing hairs, not that the medicine is making you bald. However, once you stop using minoxidil, the benefits gradually disappear. Number 2. Finasteride. If DST is the main culprit, then reducing DST makes sense. That's exactly what finasteride does. It blocks the enzyme that converts testosterone into dihydrotestosterone, DST, significantly slowing the follicle miniaturization. For many men with early male pattern baldness, it is one of the most effective evidence-based treatment available. But every medicine has potential side effects. A small percentage of patients may experience sexual side effects or mood changes, although most tolerate it well. That's why the decision should be always individualized after discussing risk and benefit with a qualified doctor. Number 3. Low-level laser therapy. These laser therapy and laser caps or combs use low-energy red light. The exact mechanism isn't completely understood, but researchers shows that they stimulate cellular energy production within the hair follicles. The improvement is generally modest and works best as an additional treatment rather than a replacement for medication. Number 4. Hair transplant. Many people think that transplantation creates new hair. It doesn't. It simply relocates healthy DST resistant follicles from back of your scalp to the areas where hair has been lost. A transplant can produce excellent cosmetic results, But if ongoing hair loss isn't controlled with medical therapy, surrounding native hairs may continue thinning. That's why surgery and medication should go hand in hand. The future of hair restoration. Researchers are now asking a much more ambitious question. Instead of slowing hair loss, can we actually regenerate new follicles? Stem cells research aims to repair damaged follicles and perhaps one day create entirely new ones. Platelet-rich plasma or PRP uses concentrated growth factors from your own blood to stimulate follicle activity. Some patients benefit, although results remain variable. Exosomes. They are tiny biological messengers that may help damaged tissue communicate and repair themselves. They are exciting, but we still need stronger clinical evidence before calling them standard treatment. Scientists are also developing topical anti-androgens that block DST directly within the scalp. Microneedles, nanoparticles, and advanced drug delivery systems may allow medication to reach follicles far more effectively than today's lotion. Hair restoration is gradually moving towards precision medicine, treating the right patients with the right therapy at the right stage of hair loss. The biggest mistake I see is waiting too long. Hair follicles becomes harder to rescue as miniaturization progresses. The earlier treatment begins, the more hair can usually be preserved. Hair loss isn't life-threatening, but it can affect confidence, identity, and quality of life. The good news is that we now understand hair biology better than ever before. Not every viral product works. Not every headline is true. But for the first time in decades, science is giving us genuinely better options. And that's something worth being optimistic about. That's all for this topic. Please don't forget to like and subscribe to my channel.